So today we'll be talking about the impact of air pollution on low-income communities in New York City. My name is Dana Marabellis, and I'll be talking about this subject. So, everywhere on Earth, people breathe air that sustains all life, but the quality of air we breathe is dictated by our location, social status, and race. As populations and people change, and grow, it is necessary to section off areas, and historically, different groups of people have been divided into sections as well. Air pollution has also changed over the many years of human civilization and has gradually worsened, especially in areas of low income communities. Air pollution results from substances that enter the atmosphere and harm living organisms, affect the climate, or damage structures. While air pollution varies around the world, the United States also struggles in confronting air pollution, especially in huge cities such as New York City. New York City is one of the most polluted cities in the world, and in low income communities, many major pollutants like power plants, major roads, or factories are built near these communities, which affects the people that live in these communities the most. As a result of the lack of social and environmental justice, lung disease, disparities in air pollution, and the damage of buildings affect low-income communities in New York City from air pollution. In big cities like New York, air pollution is quite common, but one of the impacts of air pollution in New York is lung disease. For example, a study conducted by the American Thoracic Society found that long-term exposure to ozone air pollution was associated with shortness of breath, but also with reduced lung function and respiratory exacerbations for people with a history of heavy smoking, including people with COPD. As a result, people in low-income communities are impacted more because green space is scarce, healthcare is limited, and housing is substandard. Other lung diseases found in low-income communities are asthma and lung cancer. These lung-related ailments have the habit of being more uncommon in low-income communities and can significantly damage respiratory systems in the human body. Asthma is very prevalent in young children that grow up in these areas, and according to NYC Health, across all neighborhood poverty groups, 10 to 11% of asthma-related ED visits subsequently resulted in a hospitalization. This means that neighborhoods in low-income communities are more prone to hospitalization due to a high likelihood of asthma. From all these statistics, we can tell that people living in low-income communities need more support in areas of early treatment in lung disease. Some solutions to combating lung cancer in low-income communities is by establishing better green space, having better healthcare, and building housing that's at least standard. By implementing these solutions, residents in low-income communities would be less likely to develop lung diseases. The health of residents in low-income communities is affected by air pollution through lung disease. In New York, the disparity of air pollution in low-income communities is a significant factor affecting both social and environmental justice, as many of these low-income communities consist of minority groups that are negatively affected by the disparity. Minority groups suffer from a higher level of air pollution than majority groups due to their socioeconomic status, but mainly because of the many decades of residential segregation that have occurred. Another factor of disparity of air pollution in low-income communities, aside from racial segregation, is class bias. A study conducted by the American Lung Association found that low socioeconomic status consistently increased the risk of premature death from fine particle pollution among 13.2 million Medicare recipients studied in the largest examination of particle pollution related mortality nationwide. Consequently, communities with low incomes are at a greater risk of premature death due to air pollution since they lack access to the better healthcare. Minority groups have poor quality air and have higher rates of premature deaths compared to those with higher income and members of the majority. Many low income communities are built around highways and public transportation, so they are twice as likely to be exposed to more air pollution than other communities that aren't built near these areas. A study by the Union of Concerned Scientists discovered that New York has high levels of air pollution from vehicles around the West Bronx, as the region's most polluted census tract is in the West Bronx, New York City. Exposure in the tract where 70% of the population are Latino residents and 29% African Americans residents, and 270% higher than the state average. Minority groups, including African Americans and Latinos, are the most affected by air pollution from low income backgrounds. However, there are solutions to combating disparity of air pollution in low economic communities, including empowering communities to express their experiences with air pollution and implementing solutions. Addressing racial and class bias divides in housing, and access to better health care and the data on air quality emissions. These solutions would help benefit impacted low economic communities and better equip them to fight for their rights in social and environmental justice. Disparities in air pollution impact low income communities as a result of racial and class segregation, which is a violation of both social and environmental justice. As one of the many environmental issues in New York, air pollution causes a lot of damage to buildings, especially in cities such as New York. The damage caused by air pollution to buildings occurs when acid from polluted rain corrodes the building's structure fast. This impacts low income communities as many of the housing structures that are in those communities are not in the best conditions, which can allow even more air pollution to affect people's health. A more affordable housing market and up to code housing conditions would mean people in low income communities would not have to risk their health and safety. A study conducted by the Scientific Reports found that residents of federally assisted rental housing experience higher rates of asthma and other chronic diseases and have lower access to health promoting resources such as safe exercise spaces and healthy food outlets. Evidence also indicates that health risks such as pests, mold, combustion related toxins, and inadequate ventilation are considerably greater in subsidized rental housing developments compared to other rental housing. This means that even if the government helps in providing people in low income communities housing, they are still not up to housing standards. Low income communities also, again, are more likely to experience health related problems from inadequate housing and air pollution, with many factors from air pollution and inadequate housing. Entire low income communities. Housing are more likely to be in areas where air pollution affects everyday life. For example, a study from the Scientific Reports found that our analysis indicated that the presence of PhDs, as well as the overall percentages of both PhD units and residents, are significantly greater in neighborhoods with greater annual average PM 2.5 concentrations, after accounting for spatial clustering, urbanization level, and the presence of socially disadvantaged groups. This means that both air pollution and housing for low-income communities are linked and causes disparity in social and environmental justice. However, there are solutions to help solve damages of housing from air pollution through reducing the toxic pollutants released in communities from factories, power plants, and housing communities in areas with less air pollution. The damage of buildings caused from air pollution impacts low-income communities as it provides inadequate housing to the people that live in those communities. Overall, the impact of air pollution on low-income communities in New York City has been very harmful, not just for the environment, but especially for people that live in these communities. As low-income communities suffer from lung disease due to air pollution has been linked to social and environmental injustice. In many low-income communities, major highways, factories, and power plants contribute to premature death. Disparity in air pollution among minority groups is also a factor contributing to the impact of air pollution on low-income communities due to decades of racial and class bias and separation. Furthermore, air pollution damages low-income buildings that are already not in optimal condition of housing, so communities have even more exposure to air pollution than they already do. Low-income communities have been affected by lung disease, disparities in air pollution, and damage to buildings caused by air pollution due to lack of social and environmental justice. So that would be the end of my presentation. Thank you for listening, and I hope everybody does well for this project. Bye-bye.